Hello, 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 friends. Welcome to your Health Watch with Friends. And of course, you all know me. I am Abu Berry Lane. I am so excited today because we have a special guest. We have with us Dr. Kennedy Foryoung, who is a medical doctor, and his subspecialty is neuro radiology. Big book. I can't speak because I have a big gun in the house. All righty. So, Dr. Foyong, you are welcome and thank you for taking the time to health watch with us today.
All right, thank you so much, Abu, for giving me the platform. Thank you.
You are welcome. So, just some background. Dr. Foyong is a medical doctor, like I already said, and he completed his medical training. He went to medical school in DC at the Howard University School of Medicine, and he completed his residency in diagnostic radiology. Am I
Correct.
correct?
Correct.
Yeah, at Yale in Connecticut, and he completed his residency in his subspecialty, which is neuro radiology, still at Yale in Connecticut.
Mhm.
And today we are going to focus our attention on demystifying cancer. We have to answer some questions, and we have some questions which Dr. Foyong is going to answer for us. And separate the facts from the myths around cancer, especially in our community. So, welcome again, and thank you for accepting to come on this day with us, Dr. Fayam.
Thank you so much, Abu, for giving me this opportunity. I'm looking forward to this.
Thank you so much.
Yeah.
So, we are going to dive right in. And I have actually received some questions regarding cancer. And the format we are going to go with will be asking you those questions so you can answer those questions and maybe help one or two people. We help hundreds of people, of course.
Sure.
And so here we go. You ready?
I'm
Question
ready.
number one, which is a burning question that I have heard over and over.
Okay.
That question is, in the past, we didn't hear a lot about cancers. We didn't hear of people dying of cancers. We didn't know many people that lived with cancer or had survived cancer or anything cancer related. But these days, it seems to be very rampant. Almost everyone knows someone with a cancer diagnosis that is currently undergoing maybe some kind of treatment or just received a cancer diagnosis or has died of cancer. Why is it that we are hearing of cancer these days more than we have ever heard of cancer?
Okay. That's a very, very good question. It seems that we see more cancers nowadays, which is something that I think most people that I know have become more aware of somebody in their families having a cancer or a cancer diagnosis. And there could be many reasons why that seems to be the case. Okay. The very first reason that most people think we see more cancers nowadays, which is generally accepted, is considered true, is that most of us are living longer.
Mm,
And cancers tend to be a disease that comes with age. Most cancers will come later in your life. So that means that the longer you live, the more likely you are to have a cancer. So
mm-hmm,
that's why most of us are seeing cancers, because we are seeing some of the people that we know enter into a later age. And with that, you have diseases that come with being older. And one of those diseases is cancer. I know there are unfortunate cases of cancer where we can have cancer in young people, even in people that are just normal age. In some very early ages, you can still see cancer, but most cancers tend to happen with age. Now,
mm-hmm,
yeah. So another reason that we think that that is also why we're seeing more cancers nowadays is that we are actually getting better at detecting cancers. So over time, we're getting improvement in our technology, in improvements in medicine, and our ability to detect these cancers. So we seem to think that there are more cancers just because we're catching them more. We're seeing more
Mm,
cancers. All right. And then there's another reason which I want to suggest here, which is not fully agreed on, but some people do think that we are seeing some changes in our environment, especially, for example, in the types of things that we're exposed to, the types of foods that we consume. I know that back in the days, you could get your food directly from the source. For example, getting your chicken from the source, but there's some distance now between where the chicken and you, so we have to process some of our foods. So in the process of modifying our foods, we introduce certain products or chemicals in them. That's a possible case why we may have seen an increase in the amounts of cancer. But those seem to be the three reasons that are commonly stated as reasons why we are beginning to see more and more cancers.
mm. Oh, thank you so much for throwing light on that. If I got you rightly, you have given us three very important points here to answer that question. Number one, with increasing age, people are living longer, so cancer tends to be more prevalent as we grow older. And number two is better technology in identifying or diagnosing cancers early. And number three is kind of debatable, change in our environment and the exposures that we have, for example, with our foods that we eat.
Right.
Thank you so much.
You're welcome.
So, the second question that often comes up is the question of how do we prevent these cancers? Is there anything that we can do to prevent or to reduce our risk for getting cancer?
Okay, that's another great question, and that could be a very long question to answer because there's certain things that we can do, uh, in different forms. Okay, we can do certain things to decrease our risk of having a cancer in the first place, and
Mhm,
then there's certain things that we can do to make sure that if we even if when we get the cancer, we can catch it early. Okay. So
mm,
most people, I'll give you a few things that you can implement in your day today that can help decrease the overall risk of getting a cancer. And I think the first thing that most people generally agree that increases the risk of cancer is smoking. So
mm,
tobacco use has been associated with a lot of cancers. So if somebody is smoking, it's one way that they can easily modify that behavior and not get a cancer is stopping smoking. All right. Something else that can help you with controlling cancer or can decrease cancer is actually, just having a healthy weight. So there's some cancers that come with just being out of weight and being more obese. That can sometimes lead to certain types of cancers. Other things that people would say you should do, things like physical exercise can help. And then we always look at physical exercise or certain behaviors,
mm,
exercise and diet together. So just modifying the types of foods you eat. In this case, it's generally believed that just staying away from unhealthy foods and eating things that are more healthy. Like usually fruits and vegetables would be things that are considered to be healthy. So if you can adjust your diet to eat things that do, use or consume more healthy options when it comes to food, that can also modify your risk or decrease your risk of having a cancer.
mhm,
Uh, in some cases, even alcohol consumption, decreasing your amount of alcohol you consume can also be something to think about when you want to, come up with a strategy for preventing cancer. Now,
mhm,
very very important is also taking control of your health and seeing your doctor regularly. I know it's not always easy for everybody to see their doctor. Sometimes access to health is an issue. For example, I
mhm,
know that it may not be the same in Cameroon as it is the same in the United States. There may be some differences in the ability to see a doctor. So, but that is one thing that you can do because when you go see a doctor, they check your whole body. Sometimes they even draw your blood and look at your blood and look at other things. And in some cases, they can help you detect or, not just if there's something there, they can help you with early detection or catch something if there was something there. So that's something else that you can do, which will modify or help you, uh, decrease your risk for cancer. Now, there are a few other things that I would say, depending on the type of cancer, which are cancer specific. If you take certain cancers, they have special things that you can do for certain cancers. For example, I'll just give an example here: cervical cancer. We have a vaccine called the HPV vaccine, which can help with preventing, or in some cases really decreasing your chances of getting cervical cancer. So something like that can help you modify your cancer risk. Is that all for that
Yes,
question? Okay.
that it absolutely does answer the question, but it brings me to another question that is very common. The last thing, one of the things you said is when and where possible to go to our uh, to get health checks.
Mm-hmm.
So there is a common saying that Nasigman defined doctor. If you're from Cameroon, Nigeria, or
Uh,
any of those pidgin English speaking countries, you understand what I'm saying. Nasigman defined
mm-hmm.
doctor.
Mm-hmm.
So that people tend to ask the question that if they are feeling well, why would they go to for a health check? If there is
Okay.
nothing wrong with them, they are not feeling sick. Why? Because if you go to find something that it's not there, if you go searching for something that is not there, you're certainly going to find it. So,
Mm-hmm.
what's the importance? What's the value? What's the place of being proactive in those health checks?
Yeah, so I just want to thank you for that question. That's a very important question because that really brings me to talk about health, you know,
Mhm,
and how we should approach health in general. I think that we have this view of health that you only go see a doctor when you're sick, and in most cases that is not always true, especially when it comes to what we this topic we are talking about. So I would say that for me personally, or for most doctors, we look at diseases or things that make you sick in two big categories.
mhm,
There are things that can kill you very fast, and there are things that kill you very slow. So we have certain things that we call the acute diseases that will kill you very fast, like an infection. For example, if you have malaria and you don't go see the doctor right away, or you don't go to a hospital and you get medications, you can die.
mhm,
But then there are things that kill you a little bit, they kill you slowly, so and things like diabetes, hypertension, and certain cancers will kill you slowly, and they'll take time to kill you. So
mhm,
most of the time when you can really treat them, or when you can do a lot to solve those problems, is in the beginning when you're not really feeling sick.
mhm,
It's slowly killing you, but you're not even sick yet. So that's why it's very important to see the doctor then. So when I think about healthcare, I always think about it in a holistic fashion. So just like you go to church to you pray to God, and for those of us who believe in God, we have regular time. We spend regular time seeing our going to church, and have you have faith and you see your pastor. I think it's also important to create a relationship with your doctor, to see them
mhm,
regularly.
mhm.
I'd say for the most, we don't always go to church only when we have sin. We go there even when everything is fine. So I
Yes.
think if you can bring that same mindset to medicine, that will
Mhm,
also help you. So in this case, I'll say that when it comes to that holistic health, looking at health in general, I know it's not the same for everybody. Sometimes some people have an easier time seeing a doctor, and some people do not. I'll say that most people will say generally that you should try to see a doctor at least once a year,
mhm,
whether you're sick or not, at least once a year, just to get a regular checkup. This is just like you check your car and you change the oil. Your body's like
mhm,
a machine. Go see your doctor, let them check you and see if there's anything wrong, anything that they can do to make things better for you. In some cases, they can even draw your blood and look at your blood and tell you that certain things are not normal, and they can fix it before it gets to a point where we cannot fix it anymore. So
mhm,
that's why I'm very in favor of people taking control of their health, and not leaving their health just to go away. So that
mhm,
means that if you get the chance, you should try to see a doctor once a year and just ask them to check you from head to toe. So, and also in some cases, ask them to draw your blood and look at your blood and make sure that everything looks fine. And
Mm,
then, once that is fine, you're good for another year. In some cases, when you have certain lung diseases that kill you slow or chronic diseases, then you may need to see the doctor more than once a year. In some
mhm,
cases, it could be up to 3 times a year. And in this regular doctor visits, that is when we do certain things like we can check for cancers. We do something called a screening. And if we find something, we can treat it early. And the reason why it's important to treat it early is because with most things like cancer, we don't always we are able to treat most early cancers when they are still just starting. But once
mm.
they have passed a certain stage, we cannot really treat it anymore. So it's very important that you come in and get checked up. So when you're checked up in those visits, we are able to detect very early cancers, and in some cases we can even treat them. Okay.
Thank you so much. That is very elaborate and very clear. I
Mm,
hope we all take that to heart, that it
mm,
is important for us to make time for our health, because if we don't make time for our health, we are going to make time for being sick. So that's what I can summarize that detailed answer
mm.
to. Which
Okay.
brings me to, I'll say, my final question for the day.
Okay.
So there is the general, I'll say, a general idea within many, I'll say, especially immigrant communities in the US, that cancer is not treatable. And for some people, that is one of the subsets, that cancer is not treatable. And there are other people that believe that conventional standard medicines for cancer is just a ploy to make healthcare workers and pharmaceutical companies rich.
Mm,
So there is a group that is advocating for, if you ever get diagnosed with cancer, don't worry about it. You can boil these herbs and those roots and the combination of those, and you will just be fine. What are your thoughts on that?
okay. So my thoughts on that some cancers are a myth or are not true. If you, I think it's a
Correct.
long question, so I just wanted to. So yeah, so for me, I think that cancers are real, and it's a something that we see a lot. I see this in my practice all the time, and I see people that come in and they have what we call cancers. And when I say cancer, it's a very broad, it's a very large topic.
Mhm.
There are different types of cancers, and cancers can
Right.
happen in every part of the body. Especially for women, we have what is the most common cancer is called breast cancer. So it usually happens in the breast. And then for men, usually they would have prostate cancer. And then the other cancers that happen to everybody, lung cancer, and then colon cancer. And, I would say that, for cancer, it's very important that, so for cancers, we have, you want to know that cancers don't happen in different stages. Okay, so we
Mhm.
have 4 stages of cancer. Okay, you have a stage 1, which is when the cancer just starts to grow, and it's still located in the area where it is growing.
Mhm.
And then we have the very last stage, which is called stage 4, which is when the cancer has left where it is growing and has gone to other parts of the body. Okay, and then we have a
Mhm.
stage that called stage 2 and another stage called stage 3. And I will just make it to make it simple. I'll tell you that when a cancer has gone out of where it is growing and has gone to something called a lymph node, or things that drain or filter that organ, it's called stage 3. And in that case, most cancers are very difficult to treat, and in some cases are not curable after the cancer has passed the stage 2. Usually stage 2, it becomes very difficult to treat. That's why
Mhm.
it's so important that we catch the cancer early when it is still in stage 1. So that's why early detection for cancer is key, because we know that most cases we can treat an early cancer, we can treat a stage 1 cancer when it's still in the organ, we can just take the cancer out. But if we wait until it goes to a certain stage, a late stage, then it's very difficult to treat. So that's why we insist on early detection. We insist on screening first, checking in people that don't even have cancer. And then even if you have cancer, we try to catch it early, because the earlier we catch the cancer, the better our chances are to treat it. But once we don't catch it early, then we get into a big problem where the cancer has left that part of the body and has gone out of the body, and it's very difficult to treat. So that's why I insist that people see their doctors regularly.
Mm.
And in the worst case scenario, you get a cancer at a later stage. There are still things that we can do to make you comfortable, or to live your life pain free and live your life comfortably and die with some dignity.
Mm.
So it's not always a diagnosis of death. There are certain things that we can do, and that's why it's still important that even in cases when you just don't feel right or something is going wrong, the best thing to do is still to see your doctor, as opposed to just avoiding everything. It's better to see your doctor because there's always something that we can do to help you.
Thank you so very much, Dr. Foryoung. You have
Hmm.
shed a lot of light, and
Hmm.
I hope
Hmm.
for those who sent me the questions, I hope you have answers to those questions. I have answers to the questions, and hey, continue sending your questions. Like I always say, I don't have answers to the questions, but I
Hmm.
know people that have answers to the questions. And I'm telling you, you are hearing it from the horse's mouth. Dr. Foyong's day to day practice deals with diagnostics and staging of cancer, and they need the diagnosis and they need the staging in order to guide treatment and management. So you are hearing it from the horse's mouth. So take it from the horse's mouth and take action like he advises. Any last word before you bolt, Doc?
Yeah, sure. I just wanted to say a few things. So
Sure.
if you don't take anything away from this talk, the most important things is that you should really take control of your health. Okay,
Mm,
so every single day you should be doing something that will prevent or decrease your risk of becoming sick. Just
mm,
making the small decisions every single day would always, picking a better option when it comes to food. Drinking a lot of water. Don't not smoking, consuming less alcohol. So these small decisions can add up. And then also make it a habit to see your doctor, to have a relationship with a doctor that can always check you. And if
mm.
there's something, we talk about the most important thing for cancer is screening and early detection. That's how we would help. Because once the cancer goes to a certain stage, there's no return. We cannot really help. So if you can keep these things in mind, that is the best, that's a summary of basically what we have talked about today.
Thank you so very much. And we do appreciate your time, your
Mhm.
expertise,
Mhm.
and your humility in coming to us.
No,
Thank you.
thank you. Thank you so much for having me. It was a
You-
pleasure.
Thank
Thank
you.
you.
Bye bye.
Bye bye.